This is the posterior draw test for posterior cruciate ligament laxity. For this test, the patient is lying supine with their hip flexed to 45 degrees and their knee flexed to 90 degrees. Me, as the examiner, I will be at the edge of the table in front of the patient's involved limb, and I will be holding the tibia in a neutral, stabilized position. So if it's okay, patient, is it okay if I rest on your foot to keep it stable?
Yep.
Okay. For the evaluative procedure, I'm going to be providing a posterior force on the tibia. So I will have my hands placed on each side of the joint line, on each side of the patellar tendon, and we'll be providing a posterior force. So I will be pushing back on the tibia. A positive test would be an increased amount of laxity or the lack of a firm end feel, which would imply a PCL injury, PCL sprain, or PCL tear. This is the Apley compression and distraction test for meniscal lesions. For this test, the patient is lying in a prone position and their knee is flexed up to 90 degrees. For this test, I will be applying an pressure through the tibia. For the compression aspect, I will be applying an axial load through the tibia while also internally and externally rotating the tibia. For the distraction portion of the test, I will have my hand firmly holding the knee down while I apply an upward force through the tibia to distract it. A positive test for this would be pain felt during the compression aspect and a reduced or absence feeling of pain during distraction, which would imply a meniscal tear. This is Wilson's test for osteochondral defects of the knee. For this test, the patient is off the edge of the examination table with their knee flexed to about 90 degrees. As the examiner, I will be standing in front of the patient to basically be watching for any signs or facial or verbal expressions of pain. So for this test, the patient is going to internally rotate their tibia and extend the knee up while keeping the tibia in internal rotation. The patient is told to stop the motion whenever they feel pain during the test. If they do feel the pain during the test, if you would extend your knee back up again, they are told to externally rotate the tibia and bring it back down to the original flexed position. A positive test is implied when pain is felt during the extension portion and when it is relieved during the external rotation back to flexion, which would imply osteochondral defects or osteochondritis dissecans of the intercondylar area of the medial femoral condyle. This is the apprehension test for patellar instability. For this test, the patient is lying supine with the knee extended or on a foam roller or pillow, as shown right here. For this test, I will be applying a lateral force to the patella in an attempt to distract it laterally. A positive test would implicate the patient either contracting the quads in an attempt to stop the patella from moving laterally, or any facial or verbal expressions of this test would imply an injury to the medial patellar retinaculum and would predispose the patient to patella subluxations or dislocations. This is the stutter test for a medial synovial plica. For this test, the patient is sitting off the edge of the table with the knee in a comfortable flexed 90-degree position. As the examiner, I will be standing with my hand cupped over the patella, taking care not to compress any articular surfaces. For this procedure, the patient is going to extend the knee up in a good, controlled manner, just like that, And a positive test would be any stuttering or non-fluid motion between 40 and 60 degrees of extension as the plica is moving over the medial femoral condyle. This would obviously produce an implication of medial synovial plica.